If you haven't purchased your Theracane yet, go ahead and click on the link below. If you have, this is going to be an instructional video on how to use your Theracane. Hi, Dr. Malka here, your chiropractor and acupuncturist practicing in Los Angeles, California. And like always, when you do this therapy, which is self-massage, make sure that afterwards you put an ice pack on the area every hour for 20 minutes. So what that means is, let's say I'm massaging this area up here in my shoulder, and I finish at 4. From 4 to 4:20, put an ice pack on, then put it back in the freezer. 5 to 5:20, put the ice pack on, then put it back in the freezer. Do that about 3 to 5 times. So you will be receiving a pamphlet when you get your Theracane. And I'm in a little bit of disagreement with how they utilize the Theracane, because a lot of it is sitting up and massaging your neck and coming down here, massaging your mid-back, massaging your low back. But the problem with this is when you're in a sitting position, all these muscles are contracted. So I much prefer you do this lying down. And so what you want to do in this position, well, let's start at the neck. So I'm going to go in the side lying position to show you where I'm going to be pushing on it. It's going to be right in here. You can even go up higher up into the neck. And depending on what YouTube video I give you for self-massage, you'll go ahead and massage those areas. So here's the upper part of the neck, right here, the suboccipital. If you'll notice, I'm not going straight in on this muscle. I'm coming up at an angle, because this suboccipital muscle, the one that causes that wraparound headache, is right under this skull bone. And you want to get it up in an angle and then just go back and forth. Just half an inch, massaging it from the spine and coming out. And then you can continue down the back. I'm in the mid-back area, the rhomboids, and I may want to put my arm around this way and then come down and just all the way down the low back. You can go ahead and just press in like this. Now you can massage just pinpointed, or I like to get in here and do a little cross fiber friction. See how I'm moving my hips like this? Now, if you have sciatic syndrome, that generally comes from a muscle that starts here, right where this triangle bone is, and comes over and attaches to your hip bone. That's the one that causes that tingling or pain down the back of the leg. Real common occurrence. And again, you're just getting right in here. You may want to straighten your legs so to make contact with the floor or table or bed, and you're coming up in here like this, and this is creating a torque, and this is really powerful. You can bend your legs a little bit if you want and really push into that Theracane. Oh, and coming back up here again, I forgot about another pretty major muscle. Along your scapula, which is that flat bone, you have a trigger point there. It's one of your rotator cuff muscles, your infraspinatus. And for those of you who I gave the instructional video for mouse arm, or that tingling down the arm, that's this muscle right here. And you'll just want to work in and press in there until you feel the tingling going down, and then just hold it, even up to 30 to 60 seconds. Now, how much time should we spend in each area? It's up to you. 5 minutes. If it starts to get sore, just stop, ice it like I told you, wait 1 or 2 days, and then do it again. Continuing on to the hip flexors. Now, this is a kind of a difficult one. This is actually a low back muscle. It attaches to the front of your spine, much like your neck muscles here. They're also neck muscles, but they attach to the front of your neck. And to massage this, you're going to find your hip bone, bring the Theracane right here, and just press down like this. And this is going to be a pretty sensitive area. And hold it. And if it's too sensitive, you'll want to go ahead and bend your legs, but don't leave your legs like this, because you're still engaging this muscle. You'll want to put your feet apart and then rest your knees together. That'll completely relax this muscle. And again, press down. Some people do it also in this position too, which might be a little bit easier for you. And it's just a matter of just going up and down this hip bone right here, or your iliac crest. And then this one also, the trigger point for this one causes a referral down the front of the thigh. So if you feel that at any time, just hold and rest it for 30 seconds to maybe a minute. And then this muscle also is on either side of the belly button, and it goes about 4 to 6 inches. So you can massage it there too. Find your belly button, go over an inch, and then drop down into that muscle. And then drop down. Massaging that muscle all the way down the spine, really kind of close to your pubic bone. Continuing on with the arm massaging, you'll put the Theracane like this. There we go. On this side, and you can come in and work your triceps. And then you can turn it around and get in and work the bicep muscle. And if you have tennis elbow, you'll come in like this, and you're going to really place it like here and spread your legs open so you lock this in. And come down and massage right in here in the arm area. And then if you have golfer's elbow, which is this side, and this is also that, I call it the fake carpal tunnel. Several people have come in with carpal tunnels scheduled for surgery, and they just have trigger points in the forearm. So to work those areas, come in here and massage, and you can either hold it steady, or you'll see I'm doing some cross fiber friction. That's when I go up and down the muscle. This thing starts wiggling, just hold it with the other arm. Better yet, you'd want to use this arm and hold it. And then back and forth. I'm really flicking across those arms. Obviously, you can tell these are probably pretty tight on me because of the work I do, all that massage work. And then the hands, just come in here and just get in and massage these the texting thumbs. Okay, and then we can continue on to the thigh bone. So if you have pain or issues in your upper thigh, you can come in with the Theracane and massage it back and forth, going up and down the thigh, depending on where your pain is. Maybe you have pain in the front of your knee, right here. Right over here in that shin bone, that's a real common area for what we call shin splints. And that's just back and forth. You find the bone here, and then just drop off it, and just massage it back and forth. This muscle is about 1 inch to 1.5 inches, depending how tall you are. And then the hamstring, bring the Theracane like this. And I tend to have a little tightness on this attachment of my hamstring. And just go like this and push up. You could do this also in the lying position if you want to. But I don't mind how you do it as long as the muscles relax. So this would probably be the lying or sitting position. You could just come in and do it like this. Okay, and then from here we can get in and work the calf muscle. Just bending the leg, utilizing the Theracane, and just digging in really good right in this calf muscle. And last, and certainly not least, the feet. You can just place the Theracane like this, and then just come in here and massage the feet. We try to think, this is probably the way I'd prefer it. So if you want to massage the feet, come in like this. And you can just rub those feet right in between the toes, all the way around. Great. So if you have any more questions, maybe there's some areas I did not cover, go ahead and make a comment below and I'll address that for you. And make sure to subscribe and like and ding that notification button to get more videos. Okay.
All right, that's about 10 seconds.